you are not unsure what treatment you need to have, you have to fill out our special form, upload some pictures of treatment areas. Our Dr. Mantas would evaluate your case, give recommendations, and also you would receive exact price.
I get the email, I see your pictures, I see your health history, and then I decide what exactly procedure you will need. Yeah, just your wishes we know also. For example, you want tummy tuck, but from the pictures I see that you need more, so yes, I will write it to Karolis, and Karolis will send you information. Always we will have consultation with each other in consultation room when you arrive for the surgery, but sometimes also we do online consultations. I understand all people are different. One wants to speak earlier, for one it's enough to come here to Lithuania and to speak only directly with me. So there is two possibilities, online and always when you come for the surgeries. Yes, of course, you can see. We have the database, Wellness Travels have, I have my Facebook, Instagram.
There is also plenty of non-sponsored patient journeys on our YouTube platform, link down below.
In most cases we do blood test here, but some cases, yeah, we need earlier the test results. For example, if you had the weight loss surgery, we need to know your blood test because there is different resorption of food, of supplements, so we need to know exactly. So there are some cases where we need, and more of the cases where we don't need the blood test before the surgery, because all the time, yes, we do in our clinic before the surgery, that same day or the day before.
We have a list of hotels that we are work with, so we can offer a lower price than booking.com. Regarding flights, you just need to know what airport you would prefer for departure, and we are able to find the best deal for you. No, there is no language barrier. All clinic staff speaks English fluently.
It depends on what surgery you would have. If you would have only the upper eyelid surgery, for example, so you don't need somebody to help you. If you would have mummy makeover, then it will be reasonable to have somebody to help you after that. After the surgeries, all the patients, they stay here in our clinic. It depends also on size of the surgery, amount of the procedures. So, for example, after mummy makeover, tummy tuck, the patient will stay 2 nights. Okay, so the staff here, they will take care of the patient, but after that, there is reasonable to have somebody to help you.
Companions can visit you while you're in the clinic. The hotel, all the hotels are around 10 minutes drive from the city center, so it's reasonable to have someone with you. We will pick you up from the airport, meet you with a sign, while also arrange all the pickup, transportation between clinic and the hotel, so you don't need to worry about anything.
Yes, of course, if you have them, but as I mentioned before, we ask to fill the medical form before the online consultation, the consultation through email, when we see what problems, for example, you have with your health. So sometimes the surgery is not possible, but if it is possible, we tell you what to do. But also it's good to have the documents of your diseases with you when you come here also, because second time to see again the information is better than to see one time. The compression garments you will get here in the clinic, you don't need to buy anything.
Yes, you can pay with by card. Just make sure to raise your limits before doing the transaction. There is a menu that you can choose from. There is a special diet for vegans, vegetarians. What I've been speaking with previous patients, the food is quite good here. On the day of the surgery, we pick you up from your hotel or accommodation, drive you to the clinic. Once in the clinic, usually we do the blood test and EKG. After that, we take you to your room.
So when the patient is in the room, then my assistant starts here work, all right? Yes, this is here the patient fill the documents. After that, I call here. I tell that, yeah, it's possible to come for the consultation, and both of them come to my room. Then we leave, two of us, the patient and I, and when we have the live consultation. So when we decide 100% what we will do. This before online consultation through email, it's not 100%. After live consultation, there is 100% what we will do, but in most cases it don't differ. So yes, we do consultation, I do the drawings, and after that you fill another documents, you do the payments, you go back to your room. After that, the doctor anesthesiologist speak with you. After that, you get catheter, and after that, we go to the surgery room. In most cases, the stitches are dissolvable, but some cases like eyelid surgery, I don't use dissolvable, but because there is thin skin, it's better to remove foreign body after 1 week. But all other parts, the stitches are dissolvable, so you don't need to worry about removing of the stitches. Just I ask to cover the incision sites, but also all the information I tell after the surgery. In most cases it's 1 week, 7 days, but some cases it can be shorter. Again, for example, for upper eyelid surgery, you don't need to stay here for 1 week, 3 days in general, it's enough. But all other surgeries we ask to stay patients around 1 week. So in general, you fly on 1 day. In most cases, the second day you have the surgery. After that, 1 or 2 nights you stay in the clinic. After that, couple of days in your hotel, and before flight, we ask you to come back here for the checkup. Because all the time I want to see the patient before the flight. Because some cases I recommend to stay slightly longer. So it's important to come for the checkup. The lymphatic massages, yes, they are very important, and 1 or 2 is included in the price. For example, if you stay 2 nights, yes, you will get 2 massages. But after that, you can manage with our specialist to have massages also in our clinic. It's not a problem.
Usually, standard travel insurance is enough. You receive post-op recommendations, what you need to follow. Also, we ask patients to provide with pictures every 1 week, 2 weeks, 2 months, 3 months, 6 months. So
after that, when I get the pictures from Karolis or Thomas, who works on wellness travels, when I evaluate them, and I recommend if the patient wants to do the same as recommended, or maybe it can be something different. And you know, in medicine, yes, there is no 100% guarantee. So yeah, sometimes we need to change the dressings. Sometimes I say that yes, the patient must start to use antibiotics. Sometimes I say yes, the patient needs more massages. So all these things we recommend. We don't leave you without the recommendation after that.